Good morning, Professor Laviano. We are here on the last day in Madrid at the ESPEN Congress. How's the meeting been for you?
Well, the meeting has been extremely interesting on the educational part and, of course, also on the scientific part. I mean, there are now very good evidence which has been shared during this Congress about the role of nutrition in order to improve the efficacy of treatment. I was particularly interested about the information I got here about the role of nutrition in cancer patients. This has been really fascinating because we have now very robust epidemiological data showing that, believe it or not, nutrition can influence the survival of cancer patients. There were data about patients with colorectal cancer, stage 3, receiving adjuvant therapy, and nutrition was able to improve the survival, reduce the recurrence, and you know, I was really impressed because they were doing this kind of statistical calculation, and they were saying that if all cancer patients, all colorectal cancer patients, stage 3, receiving neoadjuvant therapy, would follow these nutritional recommendations, believe there would be 38% less death. 38% less death in oncology.
That's astounding.
Huge.
It's astounding.
It's huge. I mean, I don't recall any drug which can have such an effect. So, I mean, I think that in the future, there will be more and more role for nutrition, not only in oncology. This was, of course, something extraordinary, but I think for all the patients with acute disease, with chronic disease.
So do you think if somebody who has, you talked earlier with your colleague about chronic renal disease, if people pay attention to nutrition and some of the chronic illnesses, it can really not only improve their quality of life, but maybe their outcome?
Well, actually, I was surprised because, you know, many times when you discuss with your colleagues who are not actually experts in nutrition, they always say, okay, yes, nice, but you are only improving the body weight, the composition, maybe quality of life. I think that now we can actually really tell these people that by providing nutrition, you can improve also the efficacy of treatment and in some way also the survival of these patients. And there was another interesting aspect because during this conference, there was always this word coming out which was windows of opportunity. And this was particularly true when we were discussing about nutrition in surgical patients because for decades we thought nutrition is important in these patients because we want to reduce pre-operative post-operative complications. But now there are data showing that even a short period of intervention in the perioperative period can significantly improve the survival, for example, of cancer patients undergoing surgery. So surgeons should know that if they are not providing nutrition in the perioperative period to the patients, they may reduce the chance for these patients not only to have a better post-operative outcome, but a long-term outcome. This is amazing.
So, look, you are a professor in this area, so not everybody has your knowledge and it is complex. And at a meeting like this, you have the feeling that everybody's on board with the concepts. What are the biggest challenges for you day to day in the real world when you're back at the hospital, in the ICU or other departments?
Well, you know, and this really, your question really touches another important aspect because there were actually showing the data of one of the ESPEN project, which is called Nutrition Day Oncology, and which has collected data from more than 9,000 cancer patients all over the world. And they were showing that although we believe that nutrition, and particularly some specific nutrients like omega-3 fatty acids, like branched-chain amino acids, so on, but we have data showing that they are effective during treatment. In the real world, these are not used. They're only used for the palliative phase when we know their efficacy could be extremely limited, which really means that there is a huge discrepancy between what is the evidence and what is the real practice. So the next goal of the society, but of everyone who is involved in nutrition, is really to spread the knowledge, maybe also trying to find the collaboration of patients associations, because patients association may help in raising the issue, particularly at the political level.
That makes sense. I have a controversial question that I don't like to ask people of your stature. Do we always need hard evidence for these kind of topics where we all know we need a certain combination of macro and micronutrients to live in health? Do we need this dialogue in illness with really hard evidence?
Well, unfortunately, we live in a world in which, for example, reimbursement, inclusion in guidelines is based on evidence-based medicine. So we may discuss maybe a week about should we really need a prospective randomized control trial with 10,000 patients with a proper placebo group. But then in the end, when you go to the Ministry of Health and you want that our treatment is reimbursed, they will ask for this kind of evidence.
And I know the Hippocratic Oath, of course, is you don't want to do any harm, so therefore the evidence is supporting your best intentions.
Absolutely.
Just very challenging in the field of nutrition.
Absolutely, yes. But you know what? I think that we should rely more on big data. I'm pretty sure there are so many hospitals and centers which have a lot of data in their database, in their computers, because maybe they're collecting enormous amount of data. Now the only thing is that the people working in these centers has to find maybe a PhD student, a young student, a resident who wants to sit down in computer and try to collect the data from this database and try to see what happens. I think that the data are already there and we just need to find a strategy to collect them and then to spread.
Well, that's a fantastic take-home message. I think that's particularly pertinent for the intensive care where they do some indirect colorimetry, and that's certainly something that's an action point for our listeners.
Absolutely.
Thank you very much, Professor Laviano.
Thank you so much.